Hi, I'm Veronica Montgomery, and I'm the Clinic and Patient Liaison Consultant here at the Fertility Hub. Today, I just wanted to speak to you about my latest blog, which looks at the impact of COVID-19 on media buying. Throughout this crisis, I've been writing a weekly blog series that looks at all aspects of crisis management, marketing and communications, which has been pretty much like working on quicksand. It's been ever changing every week. The guidelines are changing. The way that we're reaching patients has changed. But it's quite interesting that essentially we've now got the data from the first quarter of 2020, which obviously looked very different from how we said it when we started out the year. And then the second quarter, which is now as we're easing out of lockdown. So what I want to talk to you about specifically was media buying and planning in this week's blog. So from the outset and writing these blogs, I did argue not to suspend all marketing. And the reason for this is that patients needed support. The clinics all closed down. Here at the Fertility Hub, our traffic went through the roof because patients were desperately seeking where could they get treatment. And my advice was, don't go dark on the patients, keep up your communications. Unfortunately, not all clinics did that. And even our own patient survey showed that 68% of patients didn't feel supported by their IVF provider. There's also been recent research presented at ESHRE, and again that has been backed up that there's been a sharp increase in the mental health issues for IVF patients. So the blog looks at some of that data as well. The takeaway messaging from that is that there's a resounding themes here of anxiety, depression, uncertainty and fear. So clinics need to address that in their advertising and messaging. Now's the time to promote any support services of counselling and any specific mental health programs that you have in place for patients. This definitely means that whilst I appreciate budgets have to be cut back, budgets cannot be frozen. And in order to reach these patients, you've got to invest in your marketing and specifically really look at your media buying strategy. Media as an industry has taken a huge financial beating, with all sectors freezing their marketing budgets. The mainstream media have reported huge losses for Q1 and Q2 for 2020. Excuse me. And sadly, many publications have already closed their doors, obviously in the hardest hit areas like specialty publications who are serving industries such as entertainment, music and hospitality. I personally am a publisher, and I'm seeing so many of my colleagues filling my LinkedIn newsfeed begging for employment. These are really sad times, and essentially you as clinics, whilst these particular publications that have gone down, they may not be relevant to reach your audience, but media as a whole needs your support at this time because you need to reach the patients, and the patients are out there. So it's just the case of connecting with them and using the media to the best of your advantage. So things that are on the up are, first and foremost, online traffic increased by 70% across the globe in Q1 and Q2. If your clinic wasn't digital before, you have to be online now. In my role here at the Fertility Hub, I'm always astonished at how many IVF units don't even have an email address published. They may just have a phone number, which making a call to a clinic is a nerve-wracking experience for a patient. So try and make it easy for them. How are you driving traffic to your website? Just having a website is not enough. So you need to have a media strategy of how you're going to drive those campaigns to your site. Obviously virtual events, they've really increased as well. We've relied on Zoom meetings and hosting online seminars. Patients are information hungry, and infertility as a subject matter is very content rich. So always remember, as you see success with one patient, another one receives an infertility diagnosis. So we're also working in an ever replenishing market. Podcasts are also coming out very strong during the pandemic. People's listening habits have changed. They were downloaded and listened on people's commute, but now people are downloading them at all hours of the day. We've already launched Inside Her Information this month, which is on all streaming platforms, and we're really excited to be working with all different experts in the field. If that's something you'd like to be involved with, then please get in touch with me. And also we look at getting more for your marketing budget. So looking at those areas where markets are in decline, where there's less advertisers. So therefore you as a clinic can hit more wide stream media. But I am also seeing terrible wastage of, I'm based here in London. If I Google the search term IVF, I'm being presented with Google ads showing me clinics that still have air travel restrictions in place. And that's where you can save money. Don't just resume the pre-COVID campaigns you had running. I'm not saying don't market to patients internationally just because they can't travel at the moment, but a search word like IVF is high premium search term. So keep your presence, but not sponsoring one of the most expensive words, because that's eating your marketing dollars. Also things like, while you're focusing on your local market, while we wait for air travel to get back to the level it was before, things like radio and TV are desperate for your advertising revenue. So build your relationship with your contact there, ask for their rate card, then work out what you'd like to spend and then negotiate. Don't expect things for completely free, but do expect a lot more thrown in for goodwill. And then finally, I just sort of end off my blog because, as I said, you know, the Fertility Hub is a publishing platform and I have extensive experience in media and marketing. And I just wanted to explain the differences between a facilitator and a publisher. Because time and time again, you know, we are asked if people can have a profile page and then they'll just pay a commission on patient referrals. And the simple answer is no. You know, we are a publisher. Our knowledge and background is in medical communications. We invest heavily here at the site to drive patients to our site, to your pages when you're a partner with us. And a facilitator is totally different. They're going to work with a patient from the outset all the way through, finding them the right clinic, and they're there for the whole process. Our role is to specialise in that marketing to infertility patients and to publish information for both you as the healthcare providers and that the information that the patients are interested in hearing. So, you know, if we invested our time creating a new business as a facilitator, then our core business would suffer, and we really have invested too much of our own time, finances and energy to let that happen. We also know it takes a patient on average 2 years to decide on a clinic for treatment. So I know that the Fertility Hub will be bankrupt if we spent our money you know, marketing to patients and then waited 2 years to get paid commission. It's like asking if you were willing to treat a patient free of charge and then they only pay when you get them pregnant. It's a business model that would see you close your doors within a year as well. Now, by all means, drive a hard bargain. As I say, you know, we've all thrown the budgets out the window for this year. So media are suffering, but please be supportive and, you know, ask for a deal, because I know we as publishers are more than happy to do all that we can to support you in the current climate, and, you know, are more than willing to negotiate on what we can throw into your package. You know, we have a wealth of content. We've adapted that. We're doing online patient seminars. We're doing podcasts in addition to the main patient site. And this is a time where we've seen the most growth we've had since we launched. So we're offering a lot more value for money now as well. Our next free seminar, which will be on video marketing tips, use of podcasts, cost-effective marketing and digital marketing, is on the 28th of July at 5 p.m. It's a 40-minute seminar with a question and answer session. It's free of charge. The link to sign up for that is also in the blog. The link for the blog will appear on screen now, and my contact details are in there. Thank you very much. Take care. Speak to you soon. Bye-bye.